Hey everyone, hope you're doing well. Today I wanted to start off the conversation of insulin resistance and weight loss. So a lot of people have been asking questions about insulin resistance, but more specifically about weight loss and how we can reduce weight when it comes to PCOS. And so first things first is really figuring out if insulin resistance is present. But even before that, let's learn a little bit about insulin resistance and what it actually is and how it can really impact a PCOS woman's body in terms of weight gain specifically. So when we eat something that has glucose, say for example we eat rice gets broken down into small molecules of glucose because it's made up of carbohydrates. So when we look at what carbohydrates are made up of, simple carbohydrates are made up of long chains of glucose. So if you just think of like a pearl of just glucose molecules, and these are simple carbohydrates, so typically white rice, white bread, white pasta, things like that. A complex carbohydrate is made up of same thing, but it also has branches on top of that string of glucose molecules. So it's actually much harder to break down the glucose when it comes to complex carbohydrates. And when I say break down the glucose molecules, we're cleaving off each individual glucose molecule when we're metabolizing that carbohydrate. So when we end up metabolizing that carbohydrate and we see the glucose molecules enter into the bloodstream after passing through that metabolism, what will happen is insulin will be secreted from the pancreas. So the pancreas sees the glucose there, and insulin is created in response to carbohydrate metabolism and glucose in the body. Insulin is only created when we eat glucose, or the body sees glucose in the bloodstream. So that's super important to remember because that will really determine what happens with insulin resistance further down the line. So when the insulin sees the glucose, insulin's job and only job in the body is to store glucose away. And the way it does that, it actually binds to these basically like doors on top in the cell wall, and that opens up glucose channels to allow glucose inside the cell. So sometimes what happens is if we're constantly eating carbohydrates, we're exposing the body to lots of glucose in the bloodstream. And then after that, we're going to make a lot of insulin because insulin's job is, again, to store the glucose away, and it only gets created when glucose is in the body. So when we create lots of insulin, because we're constantly eating, carbohydrates, then what can happen is the cell can become resistant to insulin, and that means that now glucose can't get into the cell, and what insulin is going to do is it's going to store that glucose away into long-term storage. And typically long-term storage would be something in terms of like the liver, so the body will store the glucose away in terms of putting it inside the liver. So that's when we start to see fatty liver. So if you've been told you have fatty liver disease, it can be from insulin resistance. The other thing is when we see fatty liver, it is because it's not just because of alcohol. It actually is because of carbohydrate consumption. So it's really important to figure out if insulin resistance is present. Then the insulin will, if it can't get into the liver, it's going to actually store that glucose away into fat stores. And so that's where we start to see weight gain when it comes to insulin resistance. If we think about long time ago, people were not obese. And the reason why is because they weren't eating all the time. They were actually eating, breakfast, lunch, and dinner, and they weren't necessarily eating in between meals. Really interesting, over the last few years, and actually many years, we've been told in terms of type 2 diabetes and insulin resistance that we should have smaller meals throughout the day, and we should to balance blood sugar. However, if we're constantly eating and eating carbohydrates specifically, we're going to create lots of insulin, and we're going to make insulin resistance even worse. So we do want to make sure that we're not constantly eating throughout the day. And just remember, insulin is only created when we have glucose in the body. So we don't necessarily create lots of insulin or at all in response to protein. and fats, and vegetables. There is a little bit of glucose in vegetables, but definitely not as high as what we see in the carbohydrates that we eat. So it's really important to remember that anytime we eat carbs, we're going to make insulin. Insulin is going to, try to put the glucose inside the cells. If that all gets used up, it's going to store it into the liver, and that's where we may see fatty liver, and then it can impact our cholesterol. So what we'll see is high levels of LDL, which is bad cholesterol, lower levels of HDL, which is our good cholesterol, and higher levels of triglycerides, which are a fat that accumulate in the liver, especially when we see insulin resistance. So when it comes to treating insulin resistance, we really want to make sure that diet is at the forefront, because we won't necessarily change the way the cell is working and the amount of insulin we are creating until we change the way we eat. So we can put things in like metformin to help reduce the absorption of glucose in the body, and we can try to use that, but we don't necessarily really see so much weight loss with that. We really want to work on the dietary piece, because that is what's really going to drive the slowdown of insulin production and glucose metabolization, creating good metabolization for glucose. When we think about how to eat in terms of insulin resistance, we want to make sure that our food plates have lots of good healthy protein, lots of fats, lots of veggies, because we know we won't create a lot of insulin in response to these foods. It's more so when the carbohydrates come in. So lots and lots of studies out there saying low carbohydrate diet can actually help with insulin resistance, which is very true. But oftentimes people feel like when they start eating a low carb diet, they feel more deprived because they feel like they're not eating enough food. And just to remind yourself that when you remove or reduce carbohydrates, you still want to eat lots of healthy fats, because that will help you keep yourself more satiated, and then lots of good healthy protein. Vegetables are also filled with lots of fiber, and that helps to stabilize blood sugar and keep us fuller for a longer period of time. And so that's one thing to note. So how you build the food plate. The second thing is, I just need a drink here. Just finishing up my smoothie. Because we make insulin in response to glucose, we want to try not to be eating constantly throughout the day. When we don't eat, our insulin can come down so that our bodies can then go into a fat burning state. When we create insulin, we're not in this fat burning state, we're actually in a fat storage state. So anytime we're not eating, it actually helps us to actually lose weight and go into this fat burning state. So it's really important to try not to eat in between large meals if you can. And then also maybe consider intermittent fasting, because intermittent fasting allows the insulin to come down so that we can get into this fat burning state. Always remember, when you start intermittent fasting, work with a healthcare professional. I work with my patients all the time, figuring out how long they need to be fasting, what types of foods they should be eating, how they should be eating, in terms of their specific insulin resistance. The way I look for insulin resistance in blood work is doing an insulin glucose challenge test. So this is a 2-hour test at the lab, and we fast for 12 hours. Before the test, and what happens it tests your fasting insulin, your fasting glucose, to see what happens after 12 hours of fasting, because remember, after fasting our insulin should be low enough to get into this fat burning state. Sometimes when insulin resistance is quite moderate or severe, we do see higher levels of insulin even after a 12-hour fast. So we really want to work on focusing on bringing insulin levels down through diet and then through supplementation. I just did a video on myoinositol and insulin resistance on YouTube, so please check that out. That goes over all the details of myoinositol and how it really works with insulin resistance and the research behind it. it goes over the what I think are the 5 top benefits of minoxidil in terms of PCOS. And so the other thing to consider is when we do that insulin glucose challenge test, they will give us glucose, so they'll give us 75 grams of glucose, and they'll test us over a 2-hour period. So they'll test us at the half-an-hour mark after drinking the drink, the hour mark after drinking the drink, and the 2-hour mark after drinking the drink. When we drink the drink, basically it's just glucose, so it's challenging our body to see how much insulin are we creating, how much glucose gets high, how glucose rises in the bloodstream, so that we can figure out how bad the insulin resistance is and what's actually working or happening at a cellular level. So what's actually happening in our cells. So this really helps us to identify and learn how bad the insulin resistance is in your body, and then we can find treatments that can help with that. What types of foods you should be eating, how much protein, fat, carbs, and veggies you should be eating, what supplements would be best in your case depending on the severity. Maybe it's minoxidil, maybe it's berberine, maybe it's something different than that. So really trying to learn what's going on specifically in your body, to then treat it based on naturopathic principles, so diet, lifestyle, and supplementation. So this is really teaching you a little bit about what insulin resistance is, why it's important to consider insulin resistance when it comes to weight gain and PCOS, and how we can assess for it. So I talked about what insulin resistance is. Remember, insulin resistance is when we have too much insulin creation because we're eating too many carbohydrates, and we're constantly eating, so we're constantly creating insulin. That will cause us to go into a fat storing state instead of a fat burning state. And what we want to do is, in terms of diet, we want to work on eating lots of healthy fats, protein, veggies in specific amounts based on your insulin glucose challenge test, and then a little bit of carbohydrates, again based on your insulin glucose challenge test. So then assessing for insulin resistance using again, the insulin glucose challenge test that I spoke about, looking at your cholesterol panel, looking at your HbA1c, this is how well you process glucose over the last 3 months, and then coming up with a plan that kind of involves diet, how you should be eating, and then supplementation based on your specific case. What I'm going to do is I'll link my PCOS food cheat sheet below. This will help guide you on learning what foods are good when it comes to PCOS and insulin resistance, and what foods to kind of look out for. But remember, anytime we eat carbohydrates and glucose, we are going to create insulin and make insulin worse. So maybe even fasting can be an option in that circumstance as well. But you always want to work with a professional when you start fasting, because you want to be monitoring yourself, and it has to be based on your lab work and how you're feeling. So I hope this was helpful, and happy Friday. Next week I'm going to talk, next week is the 24th, so it's actually Christmas Eve, and that's when we celebrate Christmas in my family. So the next 2 weeks, I'm going to be celebrating Christmas and relaxing. Thank you for all the thumbs up. And I'll see you guys in January. I will still be posting on the PCOS Facebook group. And also, I just forgot, I did link some insulin resistance resources onto the file. So if you can check that out, that will help guide you as well in terms of figuring out what to do for insulin resistance. Hope this was helpful. I'll see you guys all soon. Happy holidays. If you celebrate Christmas, Merry Christmas, and Happy New Year. Take care.